Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A patient is referred to physical therapy with a diagnosis of right thoracic outlet syndrome. The physical therapist identifies that the patient's symptoms are being caused by entrapment at the subcoracoid space. Which of the following activities would most likely exacerbate the patient's symptoms? Option 1, reaching overhead to change a light bulb. Option 2, reaching over to wash the left armpit. Option 3, looking upward to shave the neck. Option 4, looking downward while reading a book. Thoracic outlet syndrome. Thoracic outlet syndrome is a term used to describe a group of disorders that presents with symptoms secondary to neurovascular compression of fibers of the brachial plexus. There are several areas where neurovascular compression can occur, including the interscalene triangle, the costoclavicular space, and the subcoracoid space. Compression in the subcoracoid space typically occurs with shoulder elevation, especially if external rotation is also included. Let's explore each of the options. Option 1, reaching overhead to change a light bulb. Reaching overhead to change a light bulb would require full active elevation of the shoulder. Elevation of the shoulder can exacerbate thoracic outlet symptoms when the source of the compression is occurring at the subcoracoid space. During full elevation of the shoulder, the coracoid acts as a fulcrum where the neurovascular structures are forced to change direction. Option 2, reaching over to wash the left armpit. Reaching over to wash the left armpit will require active horizontal adduction of the shoulder. Though this type of cross-body movement could provoke symptoms associated with subacromial impingement, it would not exacerbate symptoms associated with thoracic outlet syndrome. Thoracic outlet syndrome, due to compression in the subcoracoid space, is typically aggravated with movements that require full shoulder elevation. Option 3, looking upward to shave the neck. Looking upward to shave the neck would require active cervical extension. Movements of the cervical spine are more likely to cause thoracic outlet syndrome symptoms when the source of the compression is occurring at the interscalene triangle. Cervical extension would not cause significant movement to occur in the subcoracoid space. Option 4, looking downward while reading a book. Looking downward while reading a book would require active cervical flexion. Movements of the cervical spine are more likely to cause thoracic outlet syndrome symptoms when the source of the compression is occurring at the interscalene triangle. Cervical flexion would not cause significant movement to occur at the subcoracoid space. The correct answer is option 1. Let's explore the all-student data. 50% of students selected option 1, reaching overhead to change a light bulb, the correct response. 30% of students selected option 2, reaching over to wash the left armpit. 15% of students selected option 3, looking upward to shave the neck. 5% of students selected option 4, looking downward while reading a book. System classification. This question is a musculoskeletal system question which represents approximately 27% of all exam items. Content outline classification. This question is the foundations for evaluation differential diagnosis and prognosis question, which represents approximately 33% of all exam items. Level classification. This question is a level 2 question since the question requires students to integrate numerous pieces of information or to apply knowledge in a given clinical scenario. Remediation of level 2 questions occurs by increasing flexibility with academic content and by carefully analyzing decision-making processes when answering applied examination questions. Academic focus area. Looking to review related academic content? Check out pages 364 and 365 in PT Exam the Complete Study Guide. Thanks for joining us on the Score Builder's question and answer video session. See you next week.